Making predictions in any area is always a dicey proposition, but after listening to our astute members who meet in 5 healthcare CEO roundtables each month throughout the year, reading the tea leaves and a lot of articles, blogs, and op-ed pieces, I'm pretty confident in these 3+ predictions for healthcare. They all reflect the impact of government's role in funding 64% of the United States healthcare spend and 71% of the spend in the Golden State, according to PNHP, Physicians for a National Health Program. Hi, I'm Amy Grant of the ABL organization, and here are my predictions. Number 1, the ACA is here to stay, again. In case you missed it over the holidays, in the late night hours of Friday, December the 14th, Reed O'Connor, a Texas District Court judge, ruled that the Affordable Care Act was unconstitutional. His rationale for siding with a coalition of conservative states in a lawsuit challenging the law's constitutionality was because of the 2019 $695 tax penalty for not having insurance was eliminated by last year's tax reform. So he ruled the entire healthcare law is invalid, since the insurance requirement is essential to and irreseverable from the remainder of the ACA. Immediately afterwards, a coalition of 17 Democratic attorneys general, under the leadership of California's Javier Becerra, jumped on the case, stating elimination of the federal and uninsured penalty does not negate the ACA's constitutionality. Of course, the media attention was substantial enough to make the healthcare stocks plunge. Then, on December 30th, O'Connor agreed that the law, which has enabled nearly 20 million additional Americans to have health insurance, can remain in effect while under appeal. Now, while some believe the next stop for the suit will be the Supreme Court, I'm predicting that it won't get that far. Both sides of the aisle are supporting the ACA's guarantee of coverage for pre-existing conditions, which is now ingrained in the law and into the fiber of the American culture. So just like Social Security and Medicare, it too will stand. Number 2, Medicare for All will be the campaign theme of the Democratic frontrunners for 2020. Already, Elizabeth Warren has announced her Presidential Exploratory Committee, making her the first candidate to officially throw her hat in the ring. And she, along with the 70 members of the House who founded the Medicare for All Congressional Caucus, and 70% of Americans, according to a Reuters survey released last August, also supports creating a health insurance program that would be run by the federal government and would cover all Americans, replacing today's job-based policies to provide coverage to nearly half the nation. And it's not just Elizabeth Warren and Bernie Sanders singing the Medicare for All theme song. On December 29th, California Senator Kamala Harris wrote an impassioned plea for Medicare for All in the New York Times, stating she was among the first to sign the bill when it was introduced in the Senate last year. In her opinion piece, she recounts her tear-jerking story of her mother's terminal illness, interweaving her own political career history and a catalog of horrors should the law be overturned. You could definitely hear the echo of a campaign speech there. Since, as she wrote, with all her other concerns on the eve of losing her mother to cancer, financial anxiety was not one of them, thanks to Medicare. Number 3, in the meantime, Medicare Advantage will continue to grow by double digits. While Democrats will be campaigning for Medicare for All, Medicare Advantage plans for seniors continue to rake in members. In fact, CMS is projecting an 11.5% increase to 22.6 million, more than 36%, of their 60 million plus beneficiaries will be in MA plans in 2019, an all-time high. And why not? According to CMS Administrator Seema Verma, the steps that the Trump administration has taken to improve and drive competition in Medicare Advantage means more savings, more benefits, and lower costs for seniors. Specifically, average premiums will be the lowest they've been in the last 3 years, with 46% of enrollees having zero premium, and about 270 plans are allowing their 1.5 million enrollees to access several expanded benefits, including adult day care, in-home and caregiver support services, home-based palliative care, and therapeutic massage. And next year, plans will have even greater flexibility to attract new members with supplemental vision, dental, hearing, over-the-counter items, meals, nursing homes, and transportation to their doctor's appointments. With 600 new plans for 2019, 99% of Medicare eligibles will have access to an MA plan. Among those new plans and value-focused providers will be venture-backed and tech-enabled darlings, including San Francisco-based Clover Health, an MA PPO that uses data analytics and AI to serve seniors, Bright Health, which will likely be Minnesota's first unicorn, Aurora Health, a team-based MA primary care provider, Devoted Health, founded by the serial entrepreneur Park Brothers, and last but certainly not least, Oscar Health, which already has a $3.2 billion valuation. And here's my plus prediction. By 2020, someone will campaign on Medicare Advantage for all. And they could well be a Republican.